want to start out, we move to the next slide, just by mentioning the importance of taking a systems approach when we're making changes and utilizing champions within our organizations. So we know that site-wide, organization-wide, system-wide changes are more effective and sustainable. So really the overall goal is to implement changes that we know are going to be sustainable, and they're becoming that kind of standard practice for the organization. So to give an example, within a healthcare delivery setting, this could be that all patients who use tobacco are identified as tobacco users. They receive evidence-based tobacco treatment, and then this is just done on a routine basis. Or if we're thinking within public housing, this could be that all residents are made aware of the smoke-free policies, enforcement policies are in place, and that residents who smoke are offered proactive options for treatment. This is just going to happen, on a daily basis when you come in contact with those residents. So if we have a program that focuses on providing training and technical assistance to clinicians, let's say, we know that's a good start. But if we don't focus on the system as a whole, those clinicians and staff aren't going to have the support and really the infrastructure they need to kind of implement those changes and provide that treatment as a standard practice. And if we kind of think in addition to that, if we're only kind of training those individuals on their own, we would then risk for that intervention or that protocol, those policies to end if they were to leave that clinic or hospital or setting. So looking at that, implementing those changes within the system as a whole to meet the goal that you have in mind, to keep that sustained and really done kind of as an everyday practice. So a saying that rings true here would be that culture trumps strategy. So if we really think about that, culture persists, it's everywhere. And I'm sure that we can each, think back of an example where you had the best plan in place, the best strategy, but that change then was defeated by the culture of the workplace that you tried to introduce that change to. So if we're using that kind of systems thinking, that's really important. And then actions that would be driven by those champions or team members can help to create that culture shift and really carry out that change then. So it leads us to champions really being that lever for change. And there are natural champions among all of us, including yourselves, those people that are passionate about helping people quit tobacco. They're at all levels of organizations, internal and externally, and making kind of that systems change, being about working together, reminding you that the more people or organizations that you partner with, really the easier and quite honestly, the better and more sustainable that change will be. So you can really take advantage of the relationships you already have and always be looking for new working relationships and finding those champions to help sustain those efforts. So if we look at kind of where then to start, we want to look at those champions, making those changes, sustaining changes. So, two simple considerations to help kind of move those ideas and plans for change forward would be identifying the goal. So of course you guys have likely already done that. You have, the purpose that you want to make that change. You have that idea. So a likely goal is right now is for you all to really continue on with the efforts and changes that you've made so far through this project. And then thinking about, change agents. So maybe you also want to make sure that all tobacco users are offered or provided or referred assistance in quitting. You want to run a successful cessation program. You want to efficiently enforce tobacco smoke-free policies, create a tobacco-free culture. So whatever that goal may be, thinking about then who would be involved to help make that change happen. So many of you, again, are those champions behind this work. But the more people we partner with, the more champions we identify can really help to sustain and maintain that. So who do you know, who do you need to know that can help really implement this change moving forward? So if we are looking at identifying and fostering those champions, I really believe, especially in the work that we do, that champions are the place to begin. They're essential, they're really critical for working with that systems change and for systems to change. So again, you all are champions of this work. You really have that natural affinity and belief in the work that you're doing, and also for the individuals that you're working with, and that's really invaluable. So we know that champions can be influential, they can lead the cause, and also be strong advocates for systems change and help, again, maintain those changes. We want to sustain those over time, and having those champions in place will do that. So then looking at the next slide here, thinking broadly about who champions could be. So kind of thinking outside the box, you know, there's maybe certain people that we can kind of pinpoint as champions within our organizations, but thinking to external champions as well, so they can play essential roles in organizational efforts. Who can we really partner with to meet the goals? So is there maybe a champion within the community? Are there, you know, pharmacists within the community that you could bring on site, you know, at housing sites to discuss cessation medication options, provide that brief counseling? Can you partner with local health systems or a residency program to have medical students come on site and offer services or cessation education? You know, thinking within kind of service coordination, program coordination, you know, do housing programs have these coordinators that work with residents to make sure that their needs are met? So even outside of tobacco, but coordination of transportation, coordination with other, you know, social services or other programs. But then they can also then disseminate information about the quit line, the smoke-free policy. So how can we utilize some of those roles or establish those roles to be those champions? Looking at, you know, leadership, they're usually needed to kind of back those efforts for change and kind of give that stamp of approval. But they can also then be integral in seeing that the efforts are sustained. They're going to be focusing in that those changes have been made, and they're going to be sustained kind of just as that systems change as a whole. So really kind of thinking outside the box, different types of champions that you could find internal to your organization and then also externally as well. And then, you know, what are all of the tasks that champions can do? Kind of what are the roles of champions within organizations? So of course, helping to identify any problems and or goals, and then the strategies behind that to help kind of solve those problems or obtain those goals. Also sharing the objectives, again, with others who are invested in solving that problem or meeting the goal. So finding those other champions within. Identifying changes that would be necessary, really leading the charge. Again, all of you have kind of led these efforts and led the charges and helped to make those changes, which is, you know, the exact definition of that champion. But then also forming other partnerships and deepening those working relationships. So looking to see, you know, always looking to see who else can kind of help with that work, again, inside and outside of the organization to make sure that that's sustainable. And then, you know, skipping a couple, the last bullet point of looking at ongoing communication. So always kind of being in the know, keeping that system, those teams, partners in communication. You know, if that is weekly meetings, if that's, you know, quarterly meetings, if that's disseminating different information, just to make sure that the communication is there, that everyone's still on the same page, that this is still a priority, and that's being maintained moving forward. And then lastly, I just wanted to share a few examples. I'll point out that these are mostly some clinical examples as it relates to my work. So the work that we do personally here at our center, identifying and cultivating those tobacco cessation clinical champions, they're one of our top priorities for the outreach work that we do. So we use a lot of academic detailing to train the healthcare providers to integrate tobacco treatments into their current workflows, and that's really then their standard of care for helping their patients quit smoking. So that's, again, really based on that systems approach. So one of the health systems in Wisconsin that we've worked with for, you know, well over a decade, they have a key tobacco champion within their system. kind of came out of the woodworks early on, and she's just a wellness education specialist, but she is known within her system as that tobacco guru. So she's the one who, helps to update tobacco materials, puts them all in one place. She provides education to all of their staff within their system. It's standardized. So they have meetings that are set, every couple times a year. And that is just part of the protocol. They have new staff trainings that she works with to educate on tobacco cessation, all of their resources, that sort of thing. So she's really the one who has led that charge within that health system, has made and kept that tobacco cessation a priority, which is kind of our go-to if we have any questions, need to disseminate information. She's that one that we know kind of will help get that done. There's also then, beyond just her as kind of that wellness education specialist and kind of in the field as well, we have champion physicians that kind of back that work. There are those in leadership that we can go to that, again, want to make sure that this is a priority, needs are being met, the protocol is in place and it's being completed. We have an epidemiologist, so again, kind of thinking outside the box with that role. But there are many different staff that kind of within that system help to be champions to make those changes and then sustain those in making tobacco cessation a priority. I'll just point out one example because I think we're coming close to time here, but within, a little bit less clinical, I should say, within our Medicaid program, we have a really generous benefit for Medicaid members with tobacco cessation counseling and medications. And we had known a couple years ago that this was really, this benefit was really underutilized. And many clinicians as well didn't know that this coverage existed. So we created a print campaign and really found champions within the Medicaid program, Medicaid providers, even the members themselves to help, look at some of the materials we were developing for this campaign, Medicaid contracted HMOs. So again, many different players at the table that had this passion about increasing the utilization of all of these great benefits that we have, taking advantage of that. So having them all on board, sharing these materials, promoting them, testing them out. We've seen, change in practice among those Medicaid providers, and then much higher utilization of the Medicaid services that are covered for tobacco cessation. So just a couple examples there of how, many different champions within different organizations and kind of outside of organizations can make those changes happen and be sustained. So that is what I have for you today. Are there any questions for me right now?
Amy, this is Frank. It's kind of it's related to this, but I'd like to get your opinion on this. I have a friend who is a tobacco cessation counselor. She worked for me, knows this inside and out. She works for an agency now doing drug and alcohol counseling, and she's a champion for this. However, what do you do when the boss, when the head person of the agency refuses to let you do this, refuses to go smoke-free because she is still a smoker? Amy tried to talk to her and she absolutely refuses to even discuss this with her. And I've encountered this in a couple other places, especially one hospital in upstate New York, where the president of the hospital was a smoker and he just would not let anybody create any kind of plan to go smoke-free. So I'm just curious if you've encountered this, if anybody else has, and what are your suggestions so that you can do this but not get fired?
Yeah, and that's a huge challenge. I don't have a specific example off the top of my head, so if anybody else has encountered that, please share. But I think, an important route to go is just to show, many people like to see the research, they like to see the evidence, they like to see the benefit to this. So really pointing out what will they gain from this? What will it do to the organization as a whole? When we work with kind of behavioral health providers and they still don't have necessarily that culture shift of why tobacco treatment is important, and as important as the other substances they're treating, a big barrier is that staff smoke. So if you encounter that, that's something to address with them, and really kind of breaking down that barrier and seeing if they would be interested in making some changes first. So kind of having to go to that root of the problem. But I think if we can show what the value would be, what the benefit would be, what they would gain by doing this, and if that's, financial, they'll see a financial gain in this, if they'll see, better satisfaction, whatever that may be. But it's a really tough challenge when that the highest up person, if you can have others that kind of maybe lower on that totem pole that can come together. I mean, there's, more numbers, the better. There's power in numbers, I think, especially if you have, like chief medical officers or, project managers, president of kind of QI, that sort of thing that can help to lead that and to make the case for it might be helpful. But yeah, that's a tough one.
Thank you.
So this is Steve with just a brief comment. Often people leave their positions. So thinking about succession planning to replace a champion who goes either at the time they leave or even better in advance is a useful thing to do.
Yeah, that's a great point, Steve. And so making sure your champions don't leave when the people filling those champion roles may move to different positions or be moved around internally or onto new things. So planning for the next champion to be being built into champions. Thanks, Amy, for the presentation, and Frank, good question on how to overcome the barriers around like leadership buy-in, especially if the leadership may be using tobacco products themselves. And good point, Amy, on being able to depersonalize it in some ways and talk about the overall benefits and helping people who may have some of their own personal stake in the game see bigger organizational benefits about doing more on the smoke-free policies as well as increasing tobacco cessation. So that's great. Thank you. Are there any other questions before I move us on?
I was actually, sorry, I'm going to interrupt. I was just going to mention, I forgot to, that last bullet point on my presentation was just the American Academy of Family Physicians. They had done a project with office champions and had gotten some really good results. So if you want any more information, some of their resource materials, information on that project, kind of the how and who sort of thing, that's a good resource to point you in the direction of too. So just wanted to mention that since I left that off.